Okay. Good afternoon, everybody. Let's get started because we are at 12:30 here. Today I'm introducing Pablo RomeroBarrios, who's a veterinarian epidemiologist who recently joined our team at the BCCDC as a senior scientist in food safety. He's been working between the interface of veterinary science and public health for almost 20 years. Prior to his arrival at the BCCDC, he worked for several institutions in Canada and abroad, including the European Food Safety Authority and the Food and Agriculture Organization of the United Nations. He is interested in the epidemiology of foodborne diseases, risk assessment, risk prioritization, and cost-benefit analyses. And today he's talking to us about table eggs. So welcome, Pablo.
Sarah, can you hear me okay? Good. Yeah, I've only been with the BCCDC since November, so this work that I'm going to present today relates to my previous life in Italy with the European Food Safety Authority. So to start, I will just give a brief background about the role of the European Food Safety Authority, or EFSA, and then I will move on to the main topic of the presentation, which is the opinion, as we call reports in EFSA, the opinion on the egg storage and the influence of prolonging the storage on public health. I will cover materials and methods, results, and conclusions. If there is anything at any point that you find confusing, feel free to stop me and ask, and there will be time for questions at the end too. So this is EFSA. This is the building where I used to work. It's located at the north of Italy in Parma, and it's a European agency. There are a number of European agencies all across the EU, like the European Medicines Agency, the European Center for Disease Control in Stockholm. And this is the agency that deals with food safety, food and feed safety, because they take a very broad view of the safety of food. So they include also the safety of the food that animals eat for animals that will become our food. So what the EFSA does is risk assessment. A few years, well, maybe quite a few years ago in Europe, we suffered a number of food crises, including the BSE crisis, the mad cow disease crisis, as you probably know, and also there was a big dioxin contamination incident of poultry feed in Central Europe, which really led to a lot of problems. So as a result of this, the European Commission, the governing body in Europe, in the European Union, decided to create this scientific body, the European Food Safety Authority, to increase the trust in the public in how decisions were being made. So EFSA is basically the result of the complete separation between how policy decisions are made and the science that influence those decisions. So that's why EFSA only does risk assessment, and they don't draft policies or they don't enforce any of those policies. Another of the principles that underpins the work of EFSA is independence from governments, from companies, from any other vested interests. So EFSA provides independent scientific advice and also communication. They communicate on risks that affect foods. And they support the European Commission, the European Parliament, and all the 28 member states. And in doing so, they do it collaborating with all these member states, the national authorities in the European Union. So a bit of background on these concepts. You might be familiar with them or may not, but I thought it's better to repeat them. Risk analysis is the overarching framework under which the EFSA works, and in the context of food safety, the organization that sets all the principles is the Codex Alimentarius Commission, which is a commission that was created between the WHO, the World Health Organization, and the Food and Agriculture Organization. And the definition is very simple. It's a process. Risk analysis is a process consisting of three elements: risk assessment, risk management, and risk communication. As you can see in this diagram, risk communication involves everything, both risk assessment and risk management, because the principle is that you should be communicating about how you are conducting your risk assessments, as well as how you are implementing any risk management decisions. And by risk management, this is the premise of governments or supranational bodies like the European Commission, we mean weighing different policy options to address risks. So risk assessment, again, is defined by the Codex as a process that consists of 4 different steps. The first step is fairly straightforward. It's identifying the hazard that is associated to the risk. In this case, we are going to be talking about Salmonella in eggs, but you can be talking about smoking and lung cancer or exposure to other harmful substances in food or elsewhere. So that's the first step. When you are conducting a risk assessment, you need to know what you are talking about. Once you've identified the hazard, then you have 2 steps that can be conducted in parallel, exposure assessment and hazard characterization. Exposure assessment is the calculation of the likelihood of exposure to that particular hazard. So how many people eating eggs are exposed to Salmonella, for example. Hazard characterization is another step that calculates, once people are exposed to the hazard, how likely are they to become sick with whatever outcome we've decided to measure. So, and then risk characterization brings these 2 likelihoods together to obtain a final estimate of the risk. And EFSA, as I mentioned, has a very broad view of what food safety is. And they go from farm to fork, looking at anything from plant health, plant protection, GMOs, the animal, the feed that goes into the animals, the health and the welfare of the animals that produce food, chemical contaminants, the packaging, and also the nutritional components of food. In my case, I used to work for the biological hazards unit in EFSA, and obviously Salmonella is one biological hazard. So I will narrow down, I will only talk from the perspective of biological hazards in this presentation. So how do we work in practice? We have these customers, if you like, the European Commission, the European Parliament, the 28 member states, and sometimes we ourselves, or EFSA, generates its own work in a few occasions. So usually what we get is we get a question from risk managers at either the national level or the European Commission level. We get a defined question that comes to us, and then we address that question by conducting a risk assessment. The result of the risk assessment is called an opinion, a scientific opinion, and that's the terminology that is used. And the report is then sent back to whoever sent the question, and in addition to that, is published in the website of EFSA. And taking that opinion into account, the risk managers can then implement any risk management measures. And along the way, as I mentioned, EFSA, both EFSA and the European Commission or the risk managers conduct risk communication activities to consumers, the public in general, industry, etc. So the panel on biological hazards in EFSA is a panel of 21 scientists that have been selected from usually Europe, but sometimes even beyond. And they work for EFSA on a 3-year term basis. And they are the ones responsible for the outputs, the scientific outputs that that EFSA produces in that field. And we deal with, or the panel deals with a number of different fields, as you can see here: foodborne, hygiene, zoonosis, microbiology of food microbiology, then TSEs, and animal byproducts waste management. So more in detail, once we get a question, which is also called a mandate, this is all the European speak, the legal speak, which is probably not very interesting. But we get these mandates from the European Commission, and in EFSA there is a committee that decides which panel or panels have to deal with this mandate. So once the mandate is allocated to the biological hazard panel, what happens is that a working group is set up to deal with this specific mandate. And the working group is composed by a few of the scientific experts from the panel, and also external experts are selected for their specific expertise in the specific topic that we are dealing. The working group will work in drafting an opinion, and once the opinion is finalized, it goes back to the panel for what we call adoption. And once the opinion is adopted, which is like basically a rubber stamp, it is published in the website and sent back to the risk managers. This process is more complicated. I hope you can see this in the screen. It has many different steps, and some of them are really bureaucratic to ensure the independence and the transparency of the process. So any experts that want to work for EFSA have to go through a system of declarations of interest. They have to explain carefully where they work, how the work is funded, whether they have any connections with industry or with policymakers. And there is a screening process to make sure that any expert that has been invited to work for EFSA is okay in terms of conflicts of interest. In this process of developing an opinion, sometimes we involve stakeholders to obtain data, for example, from the industry, or we cooperate with partners like other agencies in either at national level or at European level. And sometimes even the draft opinions are published and made public before they are finalized to get input from the public, to give the public an opportunity. This is especially important with really hot topics like genetically modified organisms, or for example, I think with bisphenol A was another one that there was a public consultation, or acrylamide, I think, was another one. When the topic is really in the radar of the public, then very often there is a public consultation to ensure that we gather the views from the public. Once that feedback is received, it is considered, and the opinion is usually amended to incorporate any new knowledge that has been received, and then the opinion is published. So that's all for the EFSA, and now I will move on to talk about this particular mandate on eggs. We received a mandate from the European Commission, in this case, with 3 terms of reference, and in this presentation I will only cover the first one. One of the challenges when you are working as a risk assessor is to translate the terms of reference that you receive from the risk manager into a scientific question, because as you can see, maybe this is better, some of these questions are a bit vague, and sometimes they are difficult to interpret. It's not really what you like as a scientist. You want a very clear question. So part of the process is to interpret these questions and make them into a scientific question. In this case, what we basically did was to look at the production of eggs and assess the impact of the prolongation of storing the eggs, both in the retail outlets and in the household, and the impact on public health of prolonging the storage. And the reason why this opinion was how it originated was because especially during the crisis, the economic crisis in the last 5 or 6 years, there's been a lot of pressure in Europe to make better use of food and to limit as much as possible waste from especially retail outlets. And eggs are a product that have a sell-by date and a best before date, and especially I will explain this a bit more in detail later, but when the eggs are not sold by the 3-week mark, they cannot be sold. They have to be either thrown out or sent into processing. So the European Commission wanted to explore what would happen if they allowed both consumers and retailers to keep the eggs for longer. So that's how it came about. So I will cover now, I start talking about the materials and methods, and I'll start with hazard identification. So basically, what we did was to look at what hazards are associated with consumption of eggs, biological hazards. We didn't look at chemical hazards. And what came up very clearly was that Salmonella enteritidis was the main hazard associated with the consumption of table eggs. And this is because in Europe there is a lot of data collected about Salmonella, and we know that the Salmonella in general, and specifically Salmonella enteritidis, were responsible of more than 85% and 65% of egg-borne outbreaks reported in 2012. I checked the figures for 2014, which are the ones that are available now, and it hasn't changed very much. So Salmonella enteritidis is really the main suspect here. And this is because Salmonella, I don't know if you know much about Salmonella, but there are 2,500 serotypes of Salmonella. Salmonella enteritidis is one of them. But Salmonella enteritidis has a very specific ability to colonize the egg when it's being formed inside the hen. And this is not something, it's not very common, only enteritidis can do that. So by the time the egg comes out of the hen, Salmonella is already inside the egg. Most other Salmonellas are in the surface of the egg, and from there it's more difficult to contaminate food, because usually you discard the egg. Well, you always discard the eggshell. And also on the eggshell, any Salmonella tend to die with time because it dries off, and it's not so easy for them to survive. So that's why Salmonella enteritidis is such an important hazard in the context of eggs. Nevertheless, we also identified other hazards like Staphylococcus aureus or Bacillus cereus toxins, but we concluded, or the panel concluded, that table eggs are not important source of foodborne diseases apart from salmonellosis. So we focus the quantitative assessment only on Salmonella enteritidis. So moving on to the exposure assessment, so how are people exposed to Salmonella, and how likely is it that consumers are exposed to Salmonella? The inputs we used for our model were many, and this is just a summary of them. The first one was the prevalence of Salmonella enteritidis in eggs, how many eggs are contaminated with Salmonella, and after a lot of different calculations, using mainly data from the United Kingdom, we found that on average, about 0.04% of eggs are contaminated with Salmonella enteritidis. And this might not sound very much until you find out how many eggs we eat. Do you have any idea how many eggs are eaten in Canada? I looked it up because I was curious, and I was familiar with the figures in Europe, but I didn't know here. Every year, every person, how many do they eat per person? You have to, these figures I obtained, I think, include all types of eggs. So not only the eggs you make at home, but anything that goes into food products, catering, or restaurants. 225 is what the figures said. So when you multiply that times 35 million or something like that, is 7.8 billion eggs per year. So a prevalence as low as that gets really to be quite important when you have so many eggs being distributed every year. We also looked at how much Salmonella was in the contaminated eggs. So in those positive eggs, how much was it? And the research that is available shows that there are, on average, 7 Salmonella cells in each of the eggs. Another thing we looked at was the influence of the egg defense mechanisms. And I'll stop here to explain it a little bit, because this is something that sets eggs apart from many other foods. When you have a piece of meat, for example, and it's contaminated with Salmonella or with other, if you store it in poor conditions, if you leave it on the table, outside the fridge, the bacteria will grow. There is nothing stopping the bacteria to grow. Eggs, however, are different. Eggs, because of the way they were designed, they contain antimicrobial substances. The white of the egg, called the albumin, contains antimicrobial substances which are intended to protect the embryo, obviously. But what usually happens is that whenever Salmonella is deposited inside the egg when it's being formed, it usually ends up in the white. And while Salmonella is in the white of the egg, it cannot grow because it doesn't have any access to nutrients, because all the nutrients are in the yolk of the egg. And so you have the Salmonella kind of stuck there and unable to grow. It's surviving but unable to grow. So what happens as you keep the egg for longer, and you've probably seen this with eggs that are old, there is a big difference when you open an egg that is very fresh. You have the white is kind of keeps it together, and the yolk is very round. When you open a very old egg, the white goes all over the place, and the yolk also is flatter. And this is because the proteins that that form the membrane of the yolk start to deteriorate with time and with temperature. So with time, what happens is that the nutrients in the yolk start leaking from the yolk into the albumin, and that allows Salmonella to grow. So this is all very interesting, but oops, I was going the other way. So this represents the growth of Salmonella. So whenever the yolk membrane has disintegrated, you would get growth as long as the temperature of storage is greater than the minimum temperature of growth for Salmonella. This is very, very interesting, but it makes the modeling very complicated, because then you have to the growth, when you are modeling growth in a food, is usually a factor of how long it is stored at a given temperature. But here, you first have to model the deterioration of the membrane before you can model growth. So that makes it a bit more complicated. The growth rate, so that was used, is based on an equation, quite an old equation, that brings together the speed of growth and the temperature at which the food is stored. And then the other aspect, of course, is what was the time and the temperature that the egg was subject to at every stage of the process, from the farm to the consumer. And the egg production stages that were included were the farm, obviously, then you have the grading stations. So you have it's a place where eggs are assessed for quality, and then they decide whether they are good enough to be sold as table eggs, or if not, they send them to other uses like processing. The wholesaler, which would be a bigger establishment that receives all the eggs and then sends them to the supermarkets, retail, and then household and catering restaurants. The information about the duration of each of these stages and the temperature was obtained from experts in several member states. We contacted the industry and we sent a questionnaire to find out how on average, how long the eggs remained in each of these steps and at what temperature. Apart from single eggs, we also used in the household, we also investigated the impact of catering practices, the handling at the restaurants, etc. And also when eggs are pulled to make food. So when they are not used as individual eggs, but when you are in a restaurant and you're making pancakes, for example, you pull them first. And so that can also have a big impact on growth. This is not presented in this presentation, but I will show you the link for the opinion. So if you're interested, you can always look there. And the last thing we had to take into account, of course, was the cooking method. And for that, and to make our life simpler, we just choose 3 types of cooking methods: uncooked, lightly cooked, and well cooked. So that was pretty straightforward. And what this means is that for each of these cooking methods, we introduce a reduction factor in how much Salmonella was there. Okay, so hazard characterization, that's a different step. of the risk assessment process. This is done using what is called a dose response model, which expresses the possibility of people becoming sick when they eat a contaminated egg. And for this, a version of the model that had been published a few years previously was used. All these elements, all these stages were combined in a probabilistic model, a risk assessment model that already existed. And what we did was we contacted the authors of this model to help us adapting it to the European conditions. And this was done at risk, a risk assessment software. Now, this is a key slide. It's a bit complicated, but it's very important to understand the results that I will be presenting later. Eggs are in Europe. I don't know if it is the same here or not, but in Europe they are also special because they have two. Usually, food only has one sell-by date or a best before date. No, sorry, a use by date or a best before date. So basically, that's only for the consumers to know, and that's all the dates that they have. But eggs in Europe have two dates. One is for the retailers, it's called the sell-by date, and another one is for the consumer. So by law, retailers cannot sell eggs more than 3 weeks after the eggs were produced. And that's it, irrespective of how they keep it. After 3 weeks, they have to throw them out. On top of that, you have 4 weeks for consumers to eat the egg, and that's what you see in the packet in Europe. The other thing that is different in Europe is that in most countries, we do not refrigerate eggs. Here, eggs are in the fridge, in the supermarket. But in Europe, in most countries, they don't refrigerate eggs. So these things were basically, this is what we call the baseline scenario. We have these 3 weeks after laying the egg, you have to stop selling the egg, and then 4 weeks after, you have to eat the egg. It's the limit for eating the egg. And now what we did was we estimated the risk in this baseline scenario, and then we compared it with alternative scenarios. And what we did for those alternative scenarios was first to look at different dates. So we extended both dates by 3 weeks. So the sell-by date would go from 21 to 28, 35, 42. And the best before would go actually for longer, for 28 days all the way up to 70 days, so up to 10 weeks of storage in the household. And we did this changing the storage conditions at the supermarket from not using refrigeration to using refrigeration to see if that made any difference. Okay, so the results. This is a graph that shows the percentage of eggs that have the membrane of the yolk breaking down in the baseline scenario and in the what we call the worst case scenario. The worst case scenario is bringing these dates to the maximum that we evaluated. And you can see here that when you look at the blue bars, that's the baseline scenario, by the time they hit retail, around 8% of the eggs have the membrane broken. So that means that 8% of eggs would allow Salmonella to grow after the supermarket. And in the household, it's just over 15%. When you extend the storage, both at the supermarket and the household, you see a big increase in the percentage of eggs that have the membrane broken, to 25% at retail and 47% in the household. If you apply refrigeration at retail, you see that there is no change, basically, in the number of the eggs that have the membrane broken, because as you are keeping the eggs cool, the membrane doesn't get altered. But even when you are refrigerating, once those eggs get to the household, you also have a much higher percentage of broken membranes compared to the baseline scenario. So this is the first step of the process, just looking at the structure of the egg. Now, when you add Salmonella on top of that, we looked at the number of colony-forming units, CFUs, in the eggs, changing the conditions. And you'll have to bear with me because these are complicated graphs because of the number of scenarios. The combinations were really a lot because for every sell-by date that you change, then you have 7 different best before dates. So that's why there are so many bars. So these two graphs. The first one shows, the top one shows a sell-by date of 28 days. So basically moving the sell-by date from 21 to 28 days. And then within that, you have different best before dates. And you have the first bars are the baseline. So this is the risk, the growth of Salmonella was estimated, the mean to be 1.6 logs in the egg. And you can see how when you prolong the storage time in the household, the number of Salmonella grows as well. When you refrigerate, you also find that initially you have a lower number of Salmonella because of the impact of refrigeration, but after 3 weeks, the numbers of Salmonella also go up. And when you compare the lower graph is exactly the same, but instead of having a sell-by date of just 1 week over, we have doubled the sell-by date. So this is a lot, the most extreme scenario that we are comparing. And as you can see, the shape is very similar, but the numbers are higher. So if you look at the worst graph here is 3.5 logs, and here it's just below 3. And so what does it mean? What does this mean in terms of risk? This would be basically the result of the exposure assessment. People are exposed to this much Salmonella for each of these different scenarios. So how many people then get sick with this? What we did, we calculated how many people would get sick, but what we ended up doing was, instead of using the absolute number of cases, we used relative risk. So we compared the number of cases that were sick in the baseline scenario, and we divided it by, we divided the number of cases that were sick in the alternative scenario by the baseline, the number of cases that were estimated under the baseline scenario. So here you can see that baseline is obviously 1 because the number is the same. And as soon as you increase the sell-by date, you get a jump of risk. So this would be 50% higher risk than the baseline scenario, having a 28-day sell-by date and having the best before date unaltered. And you can see that for the 3 different sell-by dates that we evaluated, the risk increases with time. When you introduce refrigeration at retail, you see that during the first 3 weeks, the risk is lower than the current scenario. So in theory, policymakers, if they wanted to allow restaurants to keep the eggs for longer, they could tell them, okay, you need to refrigerate the eggs, and then you would be able to keep them for longer because the risk is lower. But when you go beyond the 3-week mark, for best before day, you still have a higher relative risk compared to the current situation. So these are the results. And as risk assessors, you stop there. You don't give recommendations for policy. You don't tell the policymakers what to do. That's their job because they have to take into account other considerations. One thing we do is we look at the assumptions and the uncertainty of all the inputs into the risk assessment, because there is always when you do a quantitative risk assessment, you are giving the risk managers hard figures, hard numbers, and there is always a risk that they will interpret them as being the reality, and that's never the case because you are using a model. So you have to look very carefully at the assumptions that you made and the uncertainty about certain parameters. So this is something that we did in this work. And the main assumption that had to be made and the uncertainty surrounded the estimates for prevalence and growth of Salmonella enteritidis in eggs, because they were obtained only from the United Kingdom. So there is always uncertainty as to whether those values are representative of the whole European Union or are only representative of the situation in the UK. The same thing for storage time and retail and household. We did as good a job as we could to obtain estimates of the length of time and the temperatures, but at the end of the day, it was just an estimate. So this could also influence the results, and ideally you would want to have better data. And the dose response model is always a source of uncertainty because dose response models are usually estimated from experimental data that was generated many years ago because they involve feeding volunteers Salmonella and seeing how many people got sick. So those trials, as you can imagine, stopped a long time ago. So now we are using outbreak data to calculate infection rates. But there is always an element of uncertainty. What we found when analyzing or checking the sources of uncertainty was that in this particular risk assessment, it wasn't so important because what we were doing was comparing a situation with another, the baseline situation with the alternative situation. And the uncertain elements were exactly the same for both. It would have been harder if we were trying to estimate the absolute risk. If the policymakers were interested in an absolute number of people that would get sick, that would be more dangerous. And that's why, although you can find the numbers in the report, the number of additional people that would get sick, we prefer to use relative risk because it was safer. And that is bringing me to the end. The conclusions that we included in the opinion was first that Salmonella, as I mentioned, is the main hazard associated with eggs. Because it's associated with most outbreaks related to egg consumption. We concluded that the prolongation of the storage time for table eggs will result in an increase of the number of illnesses per million servings, except when the eggs are well cooked. Something I didn't explain was that these graphs were for eggs that were lightly cooked. This is because what we found was that cooked eggs, if you cook the egg, doesn't matter what you've done with it before. If you have a hard-boiled egg, it's going to be safe. So hard-boiled eggs are fine. So I just chose lightly cooked eggs just because I had to choose one, and I didn't want to put both because the graphs are very similar whether you use lightly cooked eggs or uncooked eggs. So the conclusion was, unless you are cooking the eggs fully, you have an increase in the risk when you prolong the storage time. And then the magnitude of this increase will depend on how long you keep the eggs beyond the current time. And we give an example that I mentioned before, increasing the relative risk by 50% when you prolong the sell-by date by a week. Just keeping the eggs longer for a week in the supermarkets. And this is likely because when they are in the supermarket, they are not refrigerated. So you are going to have some eggs that will have the membrane broken and will allow growth of Salmonella. The increase in the risk, as I said before, might be reduced if eggs are stored under refrigerating conditions in the supermarkets. But in any case, if those eggs were stored for long enough, you would also have a greater risk beyond the 3 weeks. And then we gave some recommendations for additional research because we found that it would be very interesting. We only focused on the length of storage at retail and household and on the temperatures in both places, retail and household. We didn't really assess what would happen if you change the length of time the eggs spent before the supermarket or on the temperatures before the supermarket. So it would be nice to have a look at that in future risk assessments. And I think that's all. There was a large number of experts involved. You see here the names of the working group experts in the working group and the whole biohazard panel members. We also had Ben Daughtry from the Food Safety Australia and New Zealand agency, which was really, really good in helping us modifying their model to adapt it to our needs, and then some colleagues in EFSA. So I want to acknowledge their contribution. And last but not least, if you are more interested in this work, you can check the document. It's available online, and there you have all I don't know how many pages it has. 147 pages long, so there is a lot of information there if you are interested in eggs. So I think that's all. I hope I didn't go too fast or I didn't lose you along the way, but if I did, you have a chance now to ask me questions.
I'm just going to ask one question of clarification. I probably missed this. Did you assume that eggs were refrigerated at home or not refrigerated at home?
What we used actually was a distribution of the proportion of eggs that would be refrigerated, because in Europe you have a variety of practices, both at retail and at the household. At retail, you have some countries in the north, especially the Nordic countries, usually refrigerate the eggs. But in terms of their impact, because the population is not too large compared to the rest of Europe, we decided instead of having to choose between yes and no, we had a distribution of the proportion of eggs that would be refrigerated. And in the household, it was the same. It's the same thing, but the opposite. Most people in Europe refrigerate their eggs, but you have some countries where some people don't. That was something that I found very striking when I went to the UK from Spain. I'm from Spain originally, and there you always keep the eggs in the fridge. When I went to the UK, I found that many people, even in bed and breakfast, keep their eggs in their kitchen, just there without. And so, yeah, we used a distribution instead of yes no. So what we did in the alternative scenario was we switched that for the retail. Instead of having a distribution, it was 100% eggs refrigerated. So for household, the same. Yeah, we didn't change the household. Yeah, because changing, there is a lot of research sometimes that recommends, educating consumers, but at the end of the day, it's very hard to change the practices of the consumer. With retail, the commission can draft legislation, say you have to do this, and they will do it like they do here. But consumers are a different kettle of fish.
Thank you very much. I learned a lot about eggs. One is, I guess, a process question. Do you know roughly how long it took from when you get a request, to this mandate to publishing the opinion? How long that took?
This was around a year and a half, a bit less than a year and a half. The actual work was done in a year.
That's impressive, actually.
It was a lot of work.
Yeah. I think you may have answered my second question with your first response. I'm intrigued by this, I guess, differentiation of the sell-by date versus what I would just consider the age of the egg.
Yeah.
That you're just thinking about how long you can keep an egg for, but
yeah.
I think you answered that you were just looking at what you call the sell-by date as the period with which you could influence.
Well, you have the egg laid on day 0, and then you have retailers can sell that egg for the first 3 weeks, and then consumers, and you can buy that egg anytime. Probably not in the first 5 days because it will be. But in theory, yeah, you can go to a farm and buy it from the farm the day after is laid, and then in Europe you have 28 days to. That's the best before date. So it's not even mandated that you have to eat it. It's like yogurt. It's best before. So if it's later, it should still be okay, but it's better if you eat it before the 4-week mark. So those are the 2 dates. And what the Commission was most interested in was in modifying the sell-by date, because that's really what is affecting this issue of waste. Once it reaches the consumer, more likely than not, they will be consumed. And even if someone throws away a couple of eggs, it's not a big deal. It's mainly retailers that have this problem of unsold eggs that have reached the 3-week mark, and then they cannot do anything. Well, in theory, and this is something we also looked at, in theory they could sell them for processing, to make pasteurized liquid eggs or to make other processed foods. But the reality is that for a lot of them, it's not cost effective, and they just throw them out. So.
I'm curious, are you aware of whether in North America there are different processing procedures for eggs? Like I'd heard that the reason that we refrigerate here is something to do with the shells, but
Yeah. Yeah. In North America, eggs are washed when they are at the grading station. They are washed and yeah. I'm not sure if they add any detergents or something, but what the washing process does is the eggshell has a really thin layer covering it called the cuticle, I think, and that is maybe not removed but broken in the washing process. This layer, this membrane, protects the shell of the eggs is full of tiny pores, holes, and this cuticle is there to prevent anything going in through these tiny holes, including bacteria. So when you wash the eggs, you break the cuticle, and then you might be increasing the chances of external contamination to go inside the egg, and then you have a problem. So that's why eggs are then, after washing, they require refrigeration. In Europe, eggs are not, it is not allowed to wash the eggs because of this cuticle. This goes back a long time ago. They decided that it was better to leave the cuticle intact because it protected the egg from penetration, from external contamination. That's the difference. And that, yeah. So it's only related to the potential of introduction of external contamination from the outside.
Online question. What is the optimal temperature or the temperature range, for example, for eggs to degrade? So I guess what is there, is warmer, the warmer it gets, the worse things are, or is there a particular temperature at which things go bad quickly?
Well, there is a lot of information about degradation because the Commission also asked us to look at quality issues, and there is a bit in the opinion about that. So there is, as far as I know, there is not, the higher the temperature, the quicker the egg degrades. If you are asking about Salmonella has an optimum growth temperature of probably around 37 degrees, a minimum growth temperature of around 7 degrees, and a maximum of, I don't remember exactly, it's in this opinion, but it must be around 42, 43 degrees. So in terms of Salmonella, that those are the key parameters. For the egg quality, I haven't seen any values that tell you how long you need to keep an egg at that given temperature to see certain quality effects, because that's more quality, and we didn't really touch into that aspect very much because we are talking about public health and not so much quality issues. But yeah, the longer you keep it, if you keep it in the fridge, even if you keep it in the fridge, if you keep it long enough, you will see these quality characteristics like the white spreading, and the other thing that happens in the egg with these pores is that it loses humidity, internal humidity. So it gets smaller inside. That's why they say that sometimes to check if the egg is good, you have to put it in water, and if it floats, is bad. Is because if it floats, it means it's lost a lot of humidity inside it. That means it's a very old egg. But I wouldn't be able to give you hard numbers except for Salmonella. Salmonella, I know, the other stuff not so much.
I'm going to ask another question. So 0.04% of our billions of eggs may be contaminated with Salmonella. What do we know about what drives the initial contamination? Is it totally random? Are there particular egg producers who are going to have endemic Salmonella?
I'm not so familiar with the situation here. I'm trying to learn now about the Canadian situation or the situation in BC. In Europe, you first need the flock of hens to be infected, obviously. Then you have a number of flocks in the country. Some of them will be infected, other ones will be not infected. You need the flock to be infected, then you have maybe 50,000 hens in one of these farms. A proportion of them will be infected. And even from those hens that are infected, not all the eggs that they produce are infected. So even from a contaminated hen, only a small proportion of eggs are contaminated when they are laid. There are some numbers, I can give you numbers later, but it's a very small percentage. The prevalences with Salmonella in eggs are really, really low, even from positive birds. But it's a question of numbers. And in terms of more generally, whether it's particular producers, Salmonella can be prevented in a number of ways. At farm level, you can vaccinate against Salmonella enteritis antifimurium. You can vaccinate the hens, and that it doesn't completely eliminate the risk, but it really reduces the risk. And even if you get infections, you usually get it at a much lower level with lower loads of Salmonella. So that's something good you can do. And also, obviously, what we call in veterinary science biosecurity of the farms. If you have the farm well maintained, making sure that you don't have rodents accessing the farm, etc., etc., that also reduces the chances. So basically, yes, you can have a situation where farmers are able to keep Salmonella away and produce Salmonella-free eggs. And in some European countries, you have the Nordic countries, Scandinavian countries have achieved a complete elimination of Salmonella from their poultry flocks. So not only you have Salmonella-free eggs, you have Salmonella-free chicken and Salmonella-free meat. So it is possible to do it. In the UK, they have a vaccination scheme, and all those eggs that are from layers that are vaccinated have a lion stamped on them to show that they come from hens that are free from Salmonella. So that also is a good strategy, because obviously you can always sell more eggs when you are saying that they are Salmonella free.
I'm interested in whether the opinion actually resulted in any changes, or are you aware, or is it too early?
As far as I'm aware, there were no changes, because of course we showed that there would be an increase in public health risk. And I think the only way I was going to say that. So the only way to do this would be to make refrigeration mandatory. But of course, that has a cost associated to it. The supermarkets would need to include all the eggs in refrigeration, and that has a cost. There is a cost implication. So as far as I know, nothing has changed. Nothing has been done about this, because there was an associated risk. But I would think that if they want to move in this direction, in direction of extending the sell-by, they would have to request that they refrigerate the eggs. But with the current economic climate, I somehow doubt that they will change anything.
I think you may have already answered my question, but could you go back to the graph where it shows retail, wholesale, and household contamination rates? Yes, that one. So I think I noticed that once you implement refrigeration, the worst case scenario is the same in retail, but it's very different in households. Mm-hmm. And I was just wondering, is it just because of the time that it's stored, or is it some other factor?
Yeah, is the time. What this shows is the proportion of eggs that have the membrane broken is very similar if you're looking at the Salmonella levels at retail and the household. And what happens is, even when you have refrigerated eggs at retail, which would keep the risk as low as it is now, once they hit the consumer, you have a distribution of practices, and you have the influence of temperature and you have the influence of time. So that's why the risk increases. It's because some consumers choose not to refrigerate the egg. So even if it's been refrigerated in the supermarket, you might still have a problem in the household. Or if you keep it for long enough, The other thing that we saw was that fridges, in theory, are supposed to operate below, 5, 6 degrees, but we looked at studies that had assessed the real temperature in fridges, and a lot of people have fridges that don't work very well, especially depending on what part of the fridge you are looking for. And the door is the worst part of the fridge in terms of temperature preservation, and that's usually where eggs, or often where eggs are placed. So even if you kept it in the fridge, if you kept it long enough at, say, 12 degrees, which is a temperature that came up in the study that we looked at, you would have salmonella growth. So that's why you get the increase. In this case, it's not growth, it's just the proportion of the salmonella, of the membrane of eggs with the broken membrane, but it would be the same. The risk would increase even if you refrigerate. I mean, here you're refrigerating and you're still having cases of salmonella. So refrigeration at retail is not the solution to the problem.
Okay, if there's no further questions, I'm always going to continue to keep my eggs in the refrigerator. And thank you very much, Pablo.
Thank you.